Hey listeners, it's Dr. Gregg here with Real Chiropractic Stories, and I'm excited to have Dr. Leatherman with me today. He is an amazing person, an outstanding doctor, and he's going to share with us today his unique story and process on how he experienced chiropractic, what it was like for him. You know, his story is really unique in that he was a high-level athlete in getting started. So you'll learn about high-level athletes and how they can benefit from chiropractic care. You'll also learn his 4 things to do every day so that people will think that you're 32 rather than the 47 that he is. If you want to stay young, if you want to stay active, and you want to stay engaged in life, this is going to be the episode to listen to. If you or someone you know has an amazing chiropractic story, reach out to us. We're looking to share these with the community to help more people live a life of optimal health and well-being. Now to the episode.
Hi, I'm Dr. Gregg Gersten, a chiropractor in Northbrook, Illinois. And here at Real Chiropractic Stories, we share the real stories of real people going through life, having been introduced to chiropractic and how it's changed their life. Whether they've had health conditions or look to perform their best, these stories will help share with you the miracles that chiropractic can create.
Welcome, Sean. Thanks for joining us on another episode of Real Chiropractic Stories. I'm excited to have you here, and I want to just start off by asking you to share with me a little bit about yourself.
Well, first of all, Greg, thank you for asking me to be a part of this. A little bit about myself. Where would you really like me to start? Young age or just what's going on now?
Yeah, why don't you start with yourself now, and maybe we'll go back to a young age.
Okay. Well, I'm a chiropractic physician. I've been in practice for a little over 15 years. I live in the panhandle of Florida with my wife, who's also a chiropractic physician, and our 2 sons. We've been down here in Florida for almost 16 years now. We love living in the sun and being in this atmosphere and an active lifestyle. And, we kind of practice what we preach.
Very nice. Now, what part of the Panhandle are you in? Because when I grew up in Atlanta, we used to head down there for spring breaks and stuff like that.
Okay. Well, we're in a town called Fort Walton Beach, Florida, which is about halfway between Pensacola and Panama City.
All right. Yeah. Panama City is where we always used to head.
Yeah. It's beautiful there.
Awesome. Well, what I want to jump right into is a little bit of how you got introduced to chiropractic. And what your health was like before you got introduced to it.
Well, this is actually kind of interesting. I'm a very non-traditional chiropractor as far as how I entered into the profession. My health when I started chiropractic college was excellent. I was a personal trainer. I was competing in soccer. I was playing volleyball on a very competitive, like a sand volleyball circuit level. I was working out 3 to 4 times a week, taking supplementation, eating well, doing all those things. I was also running a landscaping business and going to night school. And I was preparing to go the medical track. So my thought process was that I was going to go into orthopedic surgery. And a friend of mine, Alan, he was a pharmacist at the time. And we were sitting down and we were talking. I was actually at the pharmacy picking him up. And I'm in my mid-20s, and, Alan's in his mid-20s, and his career's already started, and he's making great money. And he was talking about leaving the pharmacy profession. He'd only been a pharmacist for 2 years.
Wow.
And yeah, so
that's
I was like,
a short career.
Very short. So I was like, dude, what are you doing? Why are you doing this? You just got done with your degree. You're making $70,000, $80,000. You have a great job. And he frankly looked at me and he said, I hate what I do. He said, I count pills and hand them out to sick people all day long and nobody ever gets better. I see the same people over and over and over. And as I've been here over the 2 years I've been here, they fill up their grocery carts full of Coke. They have tons of pain relievers that are over the counter. It's crackers and pastas and chips. And then they come up to the counter and they get their prescriptions for all their health problems. And he said, I want to do something differently. I'm like, well, you know what? Awesome. I'm like, I'm going off to medical school. I've taken my MCATs. I'm getting ready to prepare for this. I'm like, why don't you go to medical school with me? And he was like, he goes, I'm looking into chiropractic college. And at the time I was pretty uneducated on this. And I said, what? I'm like,
yeah. What did you think chiropractors did when you were when he approached this with you?
I had no idea. But my idea was, and I'll tell you what, this was a direct quote. I'm like, why would you waste your time with that when you could be a real doctor like I'm going to be? That was a direct quote to my buddy Alan.
Wow.
And he said, I don't think you really understand what chiropractors do. And I said, well, man, come on. We all know that chiropractors are quacks. They are not real doctors. And I said, that's not what I want to do with my life. I want to help people. So the conversation didn't go well after that. You know, we had some opposing opinions. We just decided to let it lie. Well, 2 or 3 weeks later, he's going through his prep coursework of what he needs to do for prerequisites. And most of his were good because he was already, through the pharmacy program.
Right.
And he's sending off his applications. And we're sitting there, and I'm looking through the information. And I was like, wait a minute. I'm like, you got to go to school for 4 more years? And he's like, yeah, it's a doctoral program. I'm like, I didn't know that. I didn't know that chiropractors had to have 8 years of education.
Yeah, most people think that it's like a mail-in degree that you wind up getting online. But here in the United States, it winds up being a 4 years postgraduate doctorate program with internship and extensive studies.
Absolutely. At that time, I really didn't know what it was at all. And I have to admit, I've had patients that have come to the office and they thought we had associate's degrees. Mm-hmm. And so, I was one of those people. I was uninformed and I had polarizing opinions on something I didn't understand. So one thing led to another, and we talked and we talked and we talked. And I was a personal trainer. And so he kind of got me in with that. He was like, listen, you're an athlete, you're a personal trainer, you take care of your health. He goes, that's a lot like what chiropractors do. It's like they want to get to the root and the source of the problem, help you heal naturally and do the things that the body actually needs to function well versus trying to cover up symptoms and, put a pill in your body. Mm-hmm. So I actually started researching it a little bit. And the craziest thing about all this, to make a long story short, 6 months later, I'm moving across the country to Kansas City, where I got accepted to medical school at Kansas University Medical Center, where I did not want to go. I'm like, there's no way I'm moving to Kansas and going to medical school out there. 6 months later, I'm living in Kansas City going to chiropractic school.
Wow.
And it was just one thing led to another. And when I got to chiropractic school, I had never been adjusted in my life. I didn't really know what a chiropractor did, but I understood the premise of natural health care versus trying to cover things up.
During those 6 months, did you follow any chiropractors, meet any chiropractors at all, or talk with any?
I met one chiropractor. That's the level of research I did. There was a chiropractor down the road. I went down into his office. I looked around. I talked to him, said, I'm thinking about chiropractic college. I spent 15 to 20 minutes with this guy. And because I trusted Alan very much, he's a very smart guy. Mm-hmm. Because I watched his, his growth through pharmacy school and all the work he put into pharmacy, and watched him turn away from all that work. I was like, there's got to be.
Wow. I don't know. I just sneezed. Sorry about that. I don't know if you heard it or not. Wow. So you put a lot of trust in this person and in his research and understanding. You did a lot on your own too. When you had finally when was your first adjustment or visit as a patient to a chiropractor?
My first adjustment as a patient, I was probably in trimester 3. So I was almost a year through the program before I even got adjusted.
Wow. And as you were going through, I think they did an exam process, right?
Yeah, they did. Absolutely.
What sort of things did you talk with about them? Did they ask you about? And did you experience?
Gregg, you've been to school. You know what it's like to go through this. Other people don't. But when you're in school and you get a chiropractic exam in school, it's a 2.5 to 3 hour examination. And, so we talked about everything from toenails to hair follicles. You look at every piece of the body from up to down to sideways, from inside, from out. They were asking me organ system problems, surgeries, taking blood pressures, height, weight, vitals. Probably did over 250 orthopedic tests on their body, neurological tests, sensory. We're students, we're learning. And every test under the sun, it was the most thorough examination I've ever had in my life, even to this day, is what we had to do in chiropractic college to learn.
And were you still active in sports and working out 3 days a week and personal training?
Yes, at that time, yes, I was.
And did you have any health conditions or health concerns?
Not at that time. No, I'm really super healthy. But the thing that really got me the most is once I went through that whole exam, is the dysfunction that they found on some of the exam processes that I didn't know I had.
So what kind of dysfunction did they find? That's really great, because I'm excited to talk about this, because most people think that chiropractic is about a health condition and a health episode. But, as we've learned and as we share with our patients, that chiropractic is about optimal health and wellness. And before you wind up breaking down and getting to disease, we typically wind up having dysfunction.
Absolutely.
And so what kind of dysfunction did they wind up finding for you on this exam? Even though you were playing soccer and volleyball regularly, maybe not beach volleyball anymore, because Kansas City, I doubt, has the best beaches.
Yeah.
And working out 3 days a week, what kind of dysfunction did they find for you?
Well, the main things that we started to notice is I had asymmetries across my body. So as somebody who ran a landscaping business and owned a landscaping business for years, you wind up, using things like trimmers. And when you use a trimmer to edge a yard, you will actually lift it up on one side of your body and then walk backwards to edge, versus trimming, you walk forward. And holding that trimmer up in the air sideways with one arm above my head versus the other, it created a lot of imbalances where I was really super strong on the left side of my body because I was using my right side of the body for finite motions and mobility. And so I've got stability on the left, motion and mobility on the right, and it started to create muscle imbalances that you could visually see, which I had not even thought about.
So when you visually saw them, what did they look like, or what did you see?
Okay, so like my abdominals on the left side of my body are more developed than on the right.
So your six-pack was more predominant on the right than on the
I actually had an 8-pack on the left and a 6-pack on the right.
All right. So for everyone else in the world that wasn't, personal training, landscaping, 8, 20, 40 hours a week, how might they perceive or notice an imbalance like that?
I don't, you mean as far as a person who wasn't doing the things I'm doing, or as an outside observer?
Right. So you noticed it in the definition within some fine contoured muscles, but for many people, they've got several layers of skin and or fat that's over it, so they can't quite see those.
Well, the other part of that is not just the visual apparatus, but my range of motion was different from left to right. So my shoulder range of motion on the left was much better than it was on the right side. And when we did, range of motion of the neck, I had better range of motion to the left than I did to the right.
So you could turn your head to the left way better than you could to the right?
Absolutely.
So you might have experienced that when you were looking in your rearview mirror at a stop sign. You didn't have kids then, but now if you were looking to check out the kids in the back seat of the car or looking around a bend. Okay.
Sure. And again, these were not affecting my quality of life. I didn't even know they were there until they measured them. And one of the things that I learned in chiropractic school is if you don't measure it, it doesn't count. You can look at somebody, you're normal to the left and to the right, and then you measure them, they're 10 degrees off. That's dysfunction that's happening on the inside of the body that you don't have a symptom for. Eventually, that's going to come back to haunt you, especially if you keep losing those ranges of motion. And, those are things that you and I see in our practice on a daily basis that patients don't even know until you do the exam process.
Right. Another place that we might see it in our life outside of our practices is in our cars. Right? When you wind up driving your car and you notice it pulling to one side, or in these days, my car can tell me the pressure of each of the tires, and you notice that one set of tires is depressurizing versus the others. It's an indication that the alignment had gotten off in our cars. Now, I know I get my car's alignment checked every 6,000 miles, or when they tell me to. And it sounds, for most people, and it sounds like even you in getting started didn't even realize that the alignment was off in your system as you were working so vigorously, working out, being physically fit, and with I'll call it manual labor that you were doing.
Totally.
Gotcha. Okay.
Totally. And I'll tell you the other thing, I had some pretty good postural things going on. I have a short leg on the right side of my body that I never knew about, 5 millimeters off, and that affected my spine. My spine would, list to one side versus the other.
And by list, that means that you would kind of shift over or tilt, kind of like the Leaning Tower of Pisa?
Absolutely. And you can see it on the x-ray. but I couldn't see it outward.
Did you maybe even notice that in some photos, if you have photos from way back then?
When I go back and look at photos, you can see it in photos. It's just, out of sight, out of mind. It's not something that I was looking for. I wasn't a doctor at that time. Right. And so it's just not something I looked at. You looked at a woman in the store who's in her 80s and you're like, wow, look at her posture. Then you look at everybody else, and the dysfunction in our population is so common that you don't even see it.
Uh-huh. Interesting. So they found a good bit of postural distortion, range of motion distortion. Any other things that they found?
We actually, we did some hip tests as well. And I actually found out that when I stressed the joints of my hips, that I was actually getting pain on the front side of my hips on one side versus the other. Oh. Now, I didn't have pain when I walked around normally or competed or did anything else. But when I went through the orthopedic assessment, that was able to cause me pain. And once I started getting my pelvis and my low back adjusted and some range of motion exercises with my hips, all that stuff went away.
Now I just heard you say that you competed. What did you compete in?
Well, when I was in Cincinnati, before I moved to Kansas City, I was competing in volleyball tournaments and also indoor soccer tournaments.
Wow. Okay. So that's pretty intense physical activity as well. Now, once they found these distortions, you mentioned that they gave you some exercises. What else did they do with you?
Well, I got adjusted. I started out getting adjusted 3 times a week. I did that for a month. We went back in. We did a re-examination of my spine. Then we noticed about a 30 to 40% functional improvement on the test that we had before. At that point, I went for an additional 4 weeks of getting adjusted 3 times a week. Mm-hmm. We did another functional exam. I was 90% better on my functional exam. And at that point, I dropped down to getting adjusted once a week, more of a wellness basis. And I've been adjusted once a week for the past 20 years of my life.
Wow. Now, as a result of that, was there anything else that you had noticed but kind of not thought of or stuck in the back of your head that's changed?
Actually, yeah, I did. When I was growing up, I had allergies as a kid. Mm-hmm. And, being in Cincinnati, you're in the Midwest. There's a lot of humidity. I was a landscaping or grass cutter, so I'm out cutting grass all day long. I never realized that my quality of breathing wasn't that good until I started getting adjusted. And then what I noticed is I had a greater lung capacity and I wasn't getting allergies anymore. And when you move from Cincinnati to Kansas City, the climate is almost identical. There's not much difference. It's in the exact same latitudes. We get the same weather patterns. We get the same temperatures. The only thing difference is you get more wind in Kansas City because it's, flatter. Mm-hmm. But I moved to Kansas City, and when I was there for the first year, I still had some allergy issues going on, especially when I was cutting grass and that sort of thing. Once I started to get adjusted, those things went away.
Wow. And you mentioned that your breathing capacity got better. How did you notice or experience that? Or did they measure that as a part of the exams too?
Well, they did measure chest expansion. My chest expansion wasn't bad, but it did increase. Right. But really, I started noticing that I wasn't having symptoms that I had before that I thought were normal.
So what were those normal symptoms you thought that you had before?
Just itchy nose, sneezing, having to blow my nose more frequently than other people, those sort of things. When I started getting adjusted, it's like those things started to go away, and I didn't really notice it. But then I got sick. Mm-hmm. So this was maybe a year and a half into chiropractic school. I got really sick over break one time. And I remembered how horrible I felt with this sinus infection that I had. And then after I got well again, I started thinking, I was like, I haven't had any allergy symptoms since pretty much I started school, when I started to get adjusted.
Mm-hmm. And before you had started school, how often were you having allergy symptoms or sinus infections like that sickness?
Oh, all the time. I was I was the guy that had the Claritin D, in the cabinet. Like, I don't take medications because Claritin D was over the counter. It wasn't a medication. It was a over the counter. It's not a prescription. And, obviously I learned that, medicine's medicine. It doesn't matter if it's over the counter or not. It's still a drug. And so I would have, those things. There was another one, I can't remember what the name of it was, but my roommate, his mom was a nurse. So we would get these sample products out of the doctor's office that were decongestants. And when I was bad off, I would get one in the medicine cabinet and go grab some of the samples. I'm like, oh my God, I can breathe. Because they would open up the nasal passages. And, I just didn't have a need for using those things anymore.
That's pretty, and you didn't realize until you had that episode, it'd been so long since an episode.
Correct. I never put it together.
And I've seen it regularly in our office for folks who have had that. They wind up seeing that their allergy symptoms wind up diminishing. They still may have an episode, but when they have that episode, it's nowhere near as severe as it was, and it's nowhere near as frequent. So what I've found is that it takes the body laps, especially when responding to the environment, to wind up kicking in and responding the way that it naturally should. And it has to learn how to re-engage itself after it's been through many regimes where it hasn't had to, where it's relied on that pharmacology, whether it was a Claritin D or any other decongestant. So it's almost as though it has to realize, oh, wait, I got to do something here. Because we know what to do. Like you said, our bodies are a master controller. They're the pharmacy that's got all the drugs, and we just try to mimic it. And when we allow it to recognize that it's not right and kick in, it's magical what it can. It just needs the connections.
Totally agree.
Awesome. Now, since then, you've been involved with chiropractic. And what have you seen as some of the miracles in your world and in your practice?
Oh, man. The interesting thing about that, Greg, is I think we see so many things on a daily basis in our practice that we don't even consider miracles anymore. It's just kind of commonplace. And they start to, I have to admit, and this is going to sound probably not great, but you just expect people to always get a great result in your office. And when they do, it's like, no big deal. That's what we expected. Not a big deal. But the biggest things are, in my practice, I see is it's not the symptoms that people come in with, the pain. It's the symptoms that they don't come to a chiropractor for that get better. For instance, I have patients that have come in that have infertility issues, and they come because their back hurts. And, I've been trying to get pregnant. I can't get pregnant. I've had miscarriages. We've had spotty periods. We've got that. We've got guys that have some impotence issues. They're getting up at the night to go pee in the middle of the night 2 or 3 times. And then you start working on them and changing them. And then they come in and they tell you, like, hey, my equipment is working again. And thank you. I like that. It's good to have my body back. And I had a lady one time. This is actually a funny story.
I'm going to ask you, did you get any emails from wives praising and thanking you? Actually,
not emails, but they actually came into the office and said, hey, thank you for that. But
that's awesome.
My favorite story of all time has got to be, we had a woman that came into our office, and she actually did come to us because she's like, I can't conceive a child. And I've heard that chiropractic can help. So I sat down, had a consultation with her, and I told her, I said, listen, I said, there's a lot of information out there about chiropractic helping increase women's fertility rates and that sort of thing. And I said, there's actually some literature on this. These aren't randomized controlled trials. They're case studies, maybe some small cohort studies or some, retrospective studies, but there is literature that says that this works. Here's how it works. And I went to the nerve supply in the low back and how it innervates the organs of the pelvis. And we went through our exam, and I said, I can't make you any promises, but what I can tell you is, here's your dysfunction. This is what we'll do to correct it, and we'll see where we go. Well, about 2 months, 3 months later, she comes back in, and she's like, I have to tell you a story. And I was like, okay, great. And she was like, I was at the grocery store yesterday. I said, yeah. And she was like, they have an adopted daughter, okay? She was like, I was with my daughter, and we were going up and down the aisle. And I was having a conversation with her, and we were looking at melons, in the grocery store. And she pointed to the watermelon, and she said, can we get one of those? And she said, Mommy's going to have one of those in her belly pretty soon. And she told her, she said, I'm pregnant. And so she told her, she said, I started going to the chiropractor, and her daughter's like 5 or 6, right? So she's having this kid conversation. The chiropractor's working on my back, and now Mommy's got a baby in her belly.
Wow.
And so her daughter got to the front of the store, and they're starting to put stuff on, the groceries on the top of the belt. And they pull the melon out. And her daughter stands up and goes, the chiropractor put a baby in my mommy's belly. And everybody's looking at her. She's like, no. I didn't, have an affair with my chiropractor or anything else like that. And so she comes in and she tells me the story, and that's how she told me that she was pregnant.
That's pretty awesome. Oh, I love that story.
Great story. One of my favorites.
Mm-hmm. Well, in a minute or so, we're going to get ready to wrap up. But one of the challenges I'm going to support you with, John, is helping us to share more people's story in this fashion. So one of the things I'm going to challenge you to do is to ask 10 of your amazing chiropractic patients to share their story, just as we're doing here today. Can
Absolutely.
I count? Great. I'm excited about that. Now, what I want to ask you is, what has changed about your life over the last 20 years being under regular chiropractic care?
The interesting thing is, it's not the changes in my life. It's the changes that I haven't had in my life. That's the key. When I look at people that come into my office, and I look at people that I went to high school with, I just had a 30-year high school reunion. And unfortunately, I couldn't go to that, but I got to see all the pictures and everything else, and the quality of health that my former colleagues in school, in high school, the quality of their health versus the quality of mine is a night and day difference. Watching people in my neighborhoods, watching people that I've known for the past 10 to 15 years and watching them degenerate, watching them get...
How are you noticing their health degenerate, or things that just see about them that winds up being noticeably different to you? Like, gosh, I can't believe that that's not me.
Oh, heart disease, cancer, diabetes, strokes. And, I'm 47 years old. I'll be 48 next month.
Oh,
and
happy early birthday.
Thank you.
You're welcome.
But, I can still get out and run with my kids, do the things that I want to do. Have I had injuries? Yes, I've had tons of them. But I just recuperate and keep going. I don't have degenerative disease. If you take a picture of my spine, I don't have arthritis in my spine. There was
so you're saying that at 47 years of age, someone doesn't have to have arthritis within their spine?
Correct. I have one very small area of arthritis in my spine. It's in my neck, and that's because I've been in 4 different car crashes over the years, and it's minimal. I have 16-year-olds that have degeneration in their spine in my office. And it's really sad to see that when our bodies don't need to go down that road. I also have 80-year-olds in my office that have zero degeneration in their spine. Their spines look like they're in their early 20s because they've been taking care of themselves and living a lifestyle that promotes that. And chiropractic is not just about, twisting and popping the spine. It's about living a lifestyle of good health, good food, good energy, good water, getting adjusted regularly, motion, movement, feeding your body, getting good mental stimulation, emotional stimulation. It's about all that stuff. And, I'm not perfect by any means. My wife is a chiropractor, so it's easy for us to live that life in our household because we both are on board, but we're both business owners. We're both parents. We're both in a relationship with each other. We have stresses in our lives, and we don't always do the best things to combat those stresses. But at the end of the day, you go back to your education and training, and you know what's right for your health, and we apply that on a daily basis. So the things that we tell our patients to do on a daily basis are the way we live our lives, and we have integrity with that. And when patients come into my office and they think I'm in 32, 33, or 34, that's a reflection of the lifestyle I've led for the past 20 years.
Mm-hmm. What would you say are the 4 things that you tell patients that they need to do every day?
4 things that they need to do every day.
Yeah.
Number 1, drink water. Need to have at least 50% of your body weight in fluid ounces per day, every day. Number 2, essential supplements. There are only a few nutrients on the planet that you cannot get out of a healthy diet. And they're basically omega-3 fatty acids, vitamin D3, and probiotics. The rest you can get out of your diet. You don't need a multivitamin every day. Eat vegetables. If you put the right fuel in your body, it can heal better. So water and food intake, number 1 and number 2. I tell my patients every day, try to get 7 to 8 hours of sleep every night so that your body can rejuvenate. Patients will come into our office and they get adjusted and they think we're healing them in the moment. We're not. We're opening up the body's ability to receive and send signals to the neurological system. We're creating motion and movement in the joints. We're creating increased blood flow. But realistically, we're also causing little tiny mini traumas to the body, breaking down scar tissue. They need to be able to heal and rejuvenate, and that happens at night when you're sleeping. So it's no different than if you go to the gym and you work out hard, you're sore for 2 or 3 days afterwards. You're not building muscle in the gym. You're breaking down muscle so you can build it back up later. So sleep quality is hugely important. And then I would be completely remiss if I didn't mention number 4, get adjusted. Not get adjusted because I hurt or I got an owie, but get adjusted to maintain the health of your spine. I tell patients all the time, I say, do you go to the dentist? And they're like, yeah, I go to the dentist 2 to 3 times a year. I'm like, great. Do you brush your teeth every night? Oh, twice a day. Do you floss? Yeah. I'm like, well, do your teeth hurt? And they look at me with a blank stare and they're like, no, my teeth don't hurt. And I'm like, why are you doing all that work for your teeth then if they don't hurt? And then the light bulb goes off. Oh, I should take care of my spine even when it doesn't hurt. Yes, it's a system in your body. You maintain your skin, you maintain your teeth, you should maintain your spine as well. It's just part of normal maintenance in your life. Now, do you have to get adjusted every day? No, absolutely not. But if everybody on this planet was getting adjusted either every week or every 2 weeks, we could significantly alter the health and course of what's going on, especially in our communities, but not only in the world. And this isn't, chiropractic literature. This is all over the scientific literature. It's just nobody reads the literature, or if they do, they don't talk about it because it's not sexy. Mm-hmm. You can't make billions and billions of dollars on chiropractic adjustments.
Yep.
Where you can on drugs and surgery.
Most people read the TV advertisements and Facebook ads now. Wow, I love those 4. Those are 4 great steps that people should be doing every week. Now, I want to wrap up with 2 last questions. One, whom is your chiropractor? Because we want to make sure to give them props for taking care of your spine, as well as helping to take you and support you along this journey in developing your health.
Well, that is a great question. When you think about it, I actually have about 50 or 60 chiropractors. I know docs all over the country. I go to seminars a lot. I travel a lot. So I'm fortunate enough to have access pretty much everywhere I go. However, my primary chiropractor for the last 3 years has been my associate doctor, Dr. David Bach. He started working with our office. He has a lot of the same credentialing and studying I have. He does a phenomenal job. He takes care of me every week. And, I was in a car crash last year and he saw me 70 times last year, plus now I'm on back to, getting towards that wellness care again. Before that, for the last 10 years before that, my wife was my chiropractor. And obviously it has its own benefits having a chiropractor in the house. I can get adjusted at home if I need to. But realistically, most of the time, I prefer to get adjusted in the office. I prefer to get adjusted by Dr. David because he's my doctor. He's not my spouse. And so he's going to look at me critically. Even though he's an employee in my office, when I'm on the table, I'm not the owner. He's the doctor. I'm the patient. He can ask me questions, but ultimately I'm going to listen to his guidance and his judgment because he's the one taking care of my spine, not me, not anybody else. And so, and he does a phenomenal job. And I expect that he treats me just as well as any patient in the office.
I love it. I know Dr. Bach as well. We did some studying together in Boise, Idaho. He's an outstanding doctor, and Absolutely. It looks as though he's taking great care of you as well. Now, the last thing that I do want to ask you is, what would you want to tell or suggest to someone who's watching this for the first time, maybe thinking, is chiropractic for me or isn't for me? What should I do? How should I get started? Where should I go?
Okay, well, I'm gonna address that in a couple different manners. First of all, is chiropractic for me or is chiropractic not for me? Chiropractic is for everybody who has a spine, period. Now, saying that, yes, there are instances where we have patients that shouldn't be adjusted. There are contraindications to care. What's that mean? You're not safe to be adjusted with hands, but I might be able to use an instrument to mobilize your spine. Mm-hmm. It's a different way of doing things. Or, hey, I just had surgery, and no, we shouldn't be adjusting you around the surgical site for 6 to 8 weeks until that heals. There's always things that we have to consider, but it's a doctor's duty to make those decisions. as a patient or as a prospective patient and a consumer, the best thing that you can do is get online, read some literature, look at chiropractic websites in your town, start calling offices and ask about the doctor. What training do they have? What postdoctoral training do they have? What kind of cases do you see in your office? We get phone calls like that all the time to our office. And, I'm not above, well, let me go backwards. A lot of times people are like, well, you're the doctor. So what? I clean toilets in my office if I have to. If it needs to be done, it gets done because it's our office and we care about what we do there and we want patients to have a good experience. If that means I got to get on my hands and knees and clean a toilet, then I'm going to get it done. If I have to pick up trash in the parking lot, I'm going to get it done. That also means if you're a prospective patient and you're unsure of whether you want to come in or not, we're going to do a free consultation in our office. But I'm more than happy to get on the phone with you for 5 to 10 minutes to make sure, should you even come in for a consultation or do you need to be directed somewhere else in the healthcare realm before you come in? Because the last thing I want is somebody coming to my office that I can't help or someone coming to my office that doesn't want to be there. Patients need to understand that they are an active role in the process. The doctor is a facilitator and an educator, but we can't make choices for you. All we can do is give advice. And so do some research, ask some friends, ask some coworkers, where do you go? What chiropractor do you see? What was your experience like? Why did you go to that chiropractor? What kind of results did you get? And you're going to get lots of opinions. You're going to get the, hey, that chiropractor didn't help me. That chiropractor hurt me. That chiropractor saved my life. It's the same everywhere. The problem, or I should say the challenge, is not to form an opinion based on biases and not on understanding. If you were to go to your medical doctor and your medical doctor, you had a horrible experience, you wouldn't stop seeking medical care for the rest of your life. You'd say, I'm going to find a better doctor. Same thing with chiropractic, same thing with an attorney, same thing with an auto mechanic. You don't just, never going to change oil in my car because I had a bad experience. No, you're going to find a better auto mechanic. Mm-hmm. Chiropractic's the same way. We've got great physicians in chiropractic. And we have a few that are not so good either. So don't judge the profession based on the limited value that one person is able to give you. Find a better doctor, a more qualified, a better bedside manner, someone who's got better hand skills, someone who has better diagnostic skills, whatever that is. And ask for referrals. Ask your family and friends. You're going to trust them more than some ad online or some website. Look at reviews. Get online and look up a doctor's website. Oh, they have 150 reviews. Well, they have 150 that are 5-star and they've got 10 that are, 1 and 2 stars. Go read those 1 to 2 star reviews. Mm-hmm. Oftentimes you read those reviews and you look and you're like, this person's crazy. Or, hey, that's a valid concern. Did the office address it? And the office never addressed it. Well, that might not be a good office for me. Or the office says, hey, Mrs. Jones, I'm sorry you had a bad experience. We took this under advisement. We talked to our team. We talked to our staff. We've changed our policy. Great. That's an office that's doing the right thing. These are the same things that you would do for any other professional in your life. Just do your due diligence.
Mm-hmm. I love it. Those are some great guidance and suggestions. I hope our listeners wind up taking those into account. I want to thank you, Sean, for joining us because this has really been awesome and enlightening. Hearing your story, sharing your story, which is a really unique one in chiropractic. I got to tell you, I love your 4 things to do every day. We're going to make sure to blast that everywhere.
Awesome.
I want to thank our listeners for being here. If you were inspired by Dr. Sean's story, please reach out to him. You can find him. Where can people find you or get in touch with you or track you or follow you to find out more information and that you share with people as a whole to keep them healthy and safe?
Okay. Great question. My office is called Integrity Chiropractic. And again, we're located in the Florida Panhandle. If you want to look us up online, it's www.integritychiro.com. And it's also, Integrity Chiropractic on Facebook.com. Those are the best ways.
Awesome. And I'll tell you, I follow their office. They've got some inspiring information that they share, great recipes, great stories. So you'll want to like their page. Once again, I want to thank our listeners for joining us and thank Sean for being here and being with us. And I'm excited to share more of these stories with more people so that more of our community can live a life of optimal health and well-being through natural means and not need to rely on drugs and surgery. Thank you, Sean.
Absolutely. It's my pleasure. Thanks for having me.
Thanks for listening to Real Chiropractic Stories. To listen to more stories, visit our website at realchiropracticstories.com. If you like this episode of Real Chiropractic Stories and want to hear more, subscribe to our podcast now. Give us a thumbs up and a 5-star review. We love the comments and feedbacks, and that helps more people see these stories. And if you think that you've got a story that needs to be heard, reach out to Dr. Gregg on social media to share your story.